Good afternoon, everybody. My name's Scott McGann with the Falmouth Health Department, doing the town of Falmouth's COVID-19 update for December 30th. So we're doing this on Thursday, the 30th. Our website is falmouthma.gov. Our email for the health department is health@falmouthma.gov, and our phone number is 508-495-7485. So folks, I didn't do one last week, so I'm doing one. I'm going to give you both last week's numbers and this week's numbers, and it's not pretty. We're at 2,794 cases, which has been 200 confirmed PCR-only tests. I only give you PCR on this part. And for this past week, and 161 PCR positive the week before, with 54 probables, not counting home tests. Home tests are not in the system. They're not going to be going into the system. Going forward, I'll continue to post numbers until we get to such time where the numbers aren't really relevant. If we have been, the feds and the states have been pushing the home test, and so the PCR is still there, but less accurate because it's not the primary way of which you could get a test. Now, you can get a confirmed, there are people that are getting confirmed PCR, because the home kits are not nearly as accurate. I mean, I'm saying they're accurate, but not to a PCR standard. And some people are getting confirmed with a PCR, so some of those home tests are probably in that number. But it's hard if people are just basing on on home tests, they're going to be sort of off the grid tests. They're not going to really be in there. But so we've had an ugly couple of weeks with cases. Falmouth's 14-day incidence rate, this will be last week's number, the 1223, because we don't get that until Thursday afternoon, and since I'm doing this on Thursday, I can't give you the new one. The previous was 40.8, we're at 46.7, the number's up. The number's probably going to be over 50 for the incidence rate, daily incidence rate. That, again, is a number of cases if we had a population of 100,000. Falmouth's 14% positivity I get on Wednesday, so I did get that yesterday, 8.16 for the week of 12/30. The week before was 5.95. We tested about 3,800 for the 2 weeks was people that got PCRs. So you see our case count. So our case count, again, definitely the highest 2 weeks we've ever had. It's like that everywhere. It's not just unique to Falmouth. Actually, when we get into our data compared to other towns in Falmouth, we're doing, sort of middle of the road. But definitely the last 2 weeks, again, this does not count home tests or never counted antigens done at, places like Convenient MD or CVS. They've never counted. This is PCR to indicate, they're still relevant in the terms of that's how many PCRs and that's how many cases we have. But if people are starting to shy away from PCRs and moving more towards home kits, as they're being guided to a little bit, by promoting the home kits, you're going to have less tendency to get a PCR. That number is going to get less and less relevant. But, compared to itself, again, is not good. So, again, the closer these dots are and flatter that is, the better we're doing. The more it's separated and the higher the spike, like you see at the far right, shows that we've had a bad couple of weeks, worse than any 2 weeks we've ever had in terms of case counts. County-wide, same thing. Far left is the beginning of the pandemic. Our worst time was January of last year, shown in green. I'm trying to circle it if you see it on the screen. Another peak, mid-Cape happened, an outbreak happened, sort of stayed for a little while. It went down in June, and we've been with Delta and the vaccine, we've been hanging fairly decently. These are all 3-day totals, but then you see the last month or so, you see cases way up. Okay, so these are 3-day case counts of 656 in the county. Now, I want to show you, I also get the deaths. You can see where we're averaging in the teens and over 10 at that big peak. Our peak's much higher, maybe way more cases. Deaths do lag, so there may be somewhat of an increase. We're not seeing that increase. Again, we vaccinated, it will definitely help. Then again, some people who are not of good health, very elderly, very sick, even the booster or the vaccine is not always going to help them. And that's where it's bared out in the 1, 2s, and 3s for 3-day averages. So that shows you that it's another indicator that the vaccine is working where it should in the severity of the disease. Looking at hospitalizations, 13 in Falmouth and 24. None in the ICU, another good indicator that, with all the cases that we've had, again, I don't know how many home tests happened. If you add in the PCR and the antigen, I do know it's over 200, well over 200. I don't know, if there was 400 cases, we don't have any in the ICU at this point. Over the last couple of weeks, we easily had 400. That's, again, another indicator of two things. We'll talk a little bit about Omicron perhaps being not as strong, and also the vaccination working. We're highly vaccinated in Falmouth, and I think this is being bared out in the ICU being as a lower number as it is, and even our case counts in general. I think, if we were seeing numbers like this without a vaccine, I think you'd see at least double the amount of people in Falmouth and double the amount of Cape Cod, some number like that. It would be much higher. But again, 13 and 0 is the number for the 1228 count that the county provides me, and 20 and 4, which was, not too dissimilar from the previous couple weeks ago. Statewide, boatload of cases everywhere, 15,000 daily cases. The positivity for that particular time frame was 13.58. That's about as high as I've ever seen. Not good in terms of just sheer number of cases. Again, this is only going to be confirmed cases, which is PCR, not counting home tests, not counting the rapid antigen, never did. Looking at the trends, you see that the cases are way up. Positivity is really that sort of skyrocketed over the last few weeks. Hospitalizations are up, but maybe sort of plateauing. But then look at over there in purple, you see deaths. It's not. And then again, vaccinations are very effective keeping you from dying from this. So, that would be my public health service announcement. Get vaxxed, don't die. No, I don't say that. But, you can definitely see it in terms of the death rate. It does linger, but still, I don't see it spiking at the same way that the cases are. Looking at incidence rate, Falmouth falls at 46.7. Somewhere middle of the road again. The last few weeks have been middle of the road. The highest was Barnstable at 81. The state, we're still less than the state at 67.5. The state average, we're at 46.7. Some towns are lower, some towns are higher. We're sort of in the middle with incidence rate. Again, incidence rates make all these equal based on population. So it's not that, Truro is less because they have less people. It's less because it's adjusted for population. Though, obviously more rural the town, the less people are getting together, less people around, less tight quarters, less things to do in Truro, actually. Perhaps that's generally also keeps it lower. Also, there's always been a little bit of trouble getting PCR tests in the outer Cape. They usually early on relied more on the antigen, but anyway. In terms of its percent positivity, we're, again, on the mid-half lower. I think there's more towns ahead of us on that. So we're not, well, I guess these last two slides is like to say that we're not any different from what's going on elsewhere. We're sort of holding our own. We're not, these case counts aren't like, Falmouth's blowing up and no one else is. It's just everywhere right now. This is my good news chart. This is from the state every Thursday. And what this shows is breakthrough cases and the outcomes of breakthrough cases. This has been 134,565 breakthrough cases, which is 2.7% of the entire population that's been vaccinated. Of those, 3,539, or 2.63% hospitalization of the 134,000. That number is a whole percent plus lower than when this chart first came out. We were closer to 4% when this came out. So why is the hospitalization rate, fairly significantly less, somewhat less, as time progresses? Because you think, well, people have been fully vaccinated, and the further away you get from fully vaccinated, I think, the more likelihood that the vaccine isn't going to work as well, the further away you get from your 2-shot or your 1-shot regime, depending on what you got. And I think two reasons would be Omicron could be less, less severe in terms of hospitalization and deaths. And second of all, boosters. I think the boosters definitely seem to help. The data that I've read seems to indicate that, and that's probably why that number is actually lower. And also deaths, that number was closer to 0.8. It's at 0.6, so under 1% deaths among vaccinated people that get COVID. So that's a good sign that, this is a lesser, even though there's more cases, there's lesser as a percentage of all these cases, hospitalizations and deaths. And I'm trying to emphasize that. Not good on cases, holding our own with hospitalizations and deaths. This is last week's data. I don't get this again until Thursday, but we gained 451 first and second doses between the 14th and the 21st. 93% of all eligible residents have had at least one dose, with 81% of all eligible residents fully vaccinated. Most of our gains were in the under 50 category for first doses. You can see the percentages that we're at and the increase over the week, mainly in the 5 to 11. It's been, more recent that they've been eligible. The biggest gain is obviously going to be the second doses. We've done some second dose clinics at schools, so that's going to show the most increase among the second doses. So, it's a pretty good vaccine uptake so far into the pandemic, and having the vaccine available for so long, we gained. Now, the state has said they're going to start giving us vaccine data on boosters. I don't have it. Hopefully maybe next week's update that they put out on Thursday, maybe this week's, I'm not sure because I don't have it yet. It comes out about 5:30. We can see whether we start seeing boosters. So, in terms of vaccine availability, the same places, all right, pharmacies. Barnstable County does it once a week at the health office, community MD, community health center. Homebound, you should be calling the health department. If you you used to call the senior center. If you call the senior center, they're just going to call it, send it over to us. We'll take your information, send it to the VNA. They'll call you, and then we'll make an arrangement to do that homebound visit. Booster shots, there's been a bit of a delay. I'm going to post Monday, hopefully by noon, a clinic with 100 doses at the Gus Canty for boosters. We'll see how that goes, and we can do more after that. The VNA in Barnstable County right now are working mainly in the schools, getting those clinics. So they're sort of spread amongst a lot of schools. As the VNA and Barnstable County have the ability to do more, then I'm definitely all for doing more booster clinics. So that's where we are with that. That'll be on the 19th of January. I can give you that. So it'll be the 19th of January, and I'll post that on the health department's website, on Mondays, probably sometime around noon, and send out a blast. I'm sure they'll go pretty quickly. We'll take a look at doing others. I'd like to be able to do more. It's really about the availability of the nurses, the VNA right now in Barnstable County, and we'll go from there. So we will have that. I will post that on Monday. As far as testing, with schools still doing the school-based test and stay, community MD, CVS, Falmouth Hospital, the fairgrounds is free. They only Monday, Thursday, 4 to 5:30. Last time I checked, community health center, and also home tests. I do have a slide on home tests. There has been a big desire for home tests. I'll get to it in a second. Booster doses, nothing's changed. You can get any kind if it's been at least 6 months for Moderna and Pfizer, 2 months for J&J. You can mix and match, and it's been expanded to anybody 16 or older. I think it was a couple weeks ago they went 16 to 17-year-olds. You can go right on vaxfinder.mass.gov. You might have a bit of a wait. You can also do 211 if you don't have the ability to register online. Our clinic at the Gus Canty will be online. It'll be through the color system, which is a similar system when you register with the county. We'll make adjustments from there. Home kits. So Falmouth wasn't chosen by the state to receive home kits. I think it was 102 cities and towns. Falmouth was not one of them. We had quite a few calls. We did not receive home kits. Yesterday, the state released they will allow ordering directly from the kit manufacturers, and we'll wait more details. When I get more details, we'll work out what we can do, what we can get. It was just a press release. I don't have all the details exactly how to do it. I'll work through it, and we'll work through it. Home kits are not contact traced and are not going to show up in case counts, etc. Okay, so you're not going to necessarily see it because it's not going through the Maven system. It's not. And you can let us know at the health department. So you can contact the health department if you're positive, and we can provide you guidance. So what we would do is send you the sheet, and we'll talk a little bit about guidance in a second. That's changed. We'll be able to provide you that guidance on what to do. Again, we're not going to be able to spend a lot of time with each person. We get a ton of calls. We're on the phone all day long answering questions from things like daycares and businesses and individuals. So, it's going to be sort of, and we talk about contact tracing itself has been scaled back by the state. So COVID isolation and quarantine guidance update. So this is a slide. Have you ever been diagnosed with tested positive? It's yes. You stay home for now 5 days. It's not 10. If you have no symptoms or your symptoms are resolved after 5 days, you can leave your house, continue to wear a mask for 5 more days. Stay home if you have a fever. So that used to be 10 days. So that's changed. CDC changed it this week, and the state didn't even know that was going to be changed. The states did adopt them yesterday morning. If you're a close contact, it depends on your status. If you've been boosted, or have your primary series when at least 6 months for Pfizer and Moderna, or 2 months for J&J. Wear a mask around others for 10 days and test on day 5 if possible. It takes a while to incubate, so that's why we use that 5-day. If you've completed the primary series, but it's been 6 months or longer for Pfizer and Moderna, or primary series of J&J over 2 months, and you are not boosted or you're completely unvaccinated, you have to stay home for 5 days. After that, continue to wear a mask for an additional 5 days. If you can't quarantine, you must wear a mask for 10 days. Test on day 5 if possible. If you develop symptoms at any time, get tested. So that's the new guidance. We'll put this on our website as well. Just give me a little time to do that. This is something we just made up. Omicron. So in purple is Omicron. So you can see that in orange is Delta. And you can see 1225, far right. This is for the Connecticut, Maine, Massachusetts, New Hampshire, Rhode Island, and Vermont, so the New England state region. Shows us around, 40% for Omicron. This is the CDC site. So this is up to 1225, so up to Christmas. It shows that Omicron's starting to peak up. It's part of the reason why we have a lot of cases. Perhaps part of the reason why we don't have quite as much hospitalizations, though I think, the vaccine's more important, the most important. It does appear to definitely be more transmissible, definitely. Perhaps less severe. You do hear different things. Vaccines work, especially if boosted. The booster is important for this it does really help than being, a lot of people were vaccinated in the spring. Most people were vaccinated in the spring. It's time to seriously consider a booster. So that's a little bit about Omicron. That comes from the CDC site. So you can see where it went from 12-11, it was really down a couple percent. Now it's 10%, 40%. This is just what Delta did to the original versions of COVID. Boom, it's just going to start taking over. It's out competing, so to speak, the Delta. It's got an R value. We talked a little bit about R values. The higher the R value number, the more cases. So one person, it used to be 2.5 for regular COVID, and it was like 5 or 6 for Delta, I believe. And this is some number higher, and so it spreads better. Face coverings, mask advisory is still in place. The state requires it I haven't changed this slide for a while, for public transportation. Schools are required. Unvaccinated should be wearing masks. Nothing's changed at this point. And actually, the more I think about it, if you look at what recently the state and the feds have done, they've loosened up contact tracing. We don't do as much detailed contact tracing and calling contacts. The state's gotten rid of that. The state's gotten rid of the state contact tracing collaborative. The state has not implemented new guidance, and the state has lessened the quarantine requirements and has promoted more of the home kits. Well, what does that tell us? It tells us that we're taking more personal responsibility. It's going more in the direction of personal responsibility, more towards endemic, more towards it's something we need to live and manage. They're not working their direction towards more shutdowns and more, at least on the federal, at least by those 3 actions is what I'd say. Some towns have implemented things such as vaccine mandates for public places or mask mandates. That'll be a decision of the Board of Health for any given town. They'll get provided the data, get provided this presentation. It's not the direction the state's moving in, or the feds are moving in, frankly, because we haven't gone into that. We're actually gearing away from sort of that strictness that we had in 2020, at least in 2021 with the contact tracing, relying more on boosters, personal responsibility, lots of tests through home tests, not getting worked up about the PCR, the calling, the contacts, and the things that we've been doing now for nearly 2 years. So that's sort of the direction we're heading. At least the states and the feds are guiding us. Towns are able to choose and go into more detail, if they want more. And some towns have, especially up around Boston. So we have them indoor mask advisory. We're telling you that take care of your personal responsibility. I personally see more people than not wearing masks than that don't wear masks, when I've gone out. But the more serious medical conditions you have, the more seriously you want to take, mask wearing. We do advise that everyone wear a mask indoors. And that's where we are with that. Falmouth metrics, we're definitely still high. 326 is our daily rate times 7 for that week, which is in the high category. We're in the moderate category. Actually, I should have moved this over. It should be over in the substantial. We went to 8.16. That should be moved over. Sorry about that. That should be in the substantial and high. Hospitalizations, holding our own. That's not the highest numbers we've seen. We were in the high teens back in, so, and again, ICU, that's a pretty good considering the amount of cases. The amount of cases we're getting between 3 towns, I think pretty much Falmouth hospitals, maybe 3 towns or so. Whatever the radius is that Falmouth Hospital serves, to have no ICU beds at this given time is encouraging. Our vaccination is always going to be good. So, again, as a recap, Falmouth case counts are the highest we've ever. Most likely going to be, 4 to 6 more weeks or so, hopefully. Consider your vaccine status, health conditions, et cetera, when you make your decisions. I think we're gearing more towards it being endemic. We strongly urge you to wear face coverings indoors, especially vaccine status. All right? Stay home when you're sick is a key one. Even the thing about, Omicron, heard it's more upper respiratory. You hear a lot of different things. And you've been vaxxed and you've been boosted, that mild symptoms might actually be it, right? And that's why we're seeing a lot of home kits and home kit positives. They're mildly symptomatic, a lot of it, and at least I'm hearing anecdotally. So, again, you got to consider it. And if you're get tested as much as if you guys can get some home kits, we're working on getting some for you, but we'll see how that works. I can't promise anything right now. But again, the milder disease, that's what the virus wants. It wants you all walking wounded so that it can spread and spread and spread. It's kind of the direction it wants to be in anyway. So, again, consider your personal status, consider your health, consider what, your comfort zone, and, do it appropriately. Vaccine, again, is still eligible to anyone over 5. 3rd dose boosters, highly recommend it. Seriously consider them. It's really going to help, especially if it's really early on, early in the spring when you got your 2-dose series. We'll have a posted clinic up again. So case data suggests, this is from last slide, but it doesn't really change. You're about 5.7 times more likely to contract COVID if you're not vaccinated, based on the numbers that I pulled the last 100 cases last week. And that number was consistent for what I did it a couple of weeks earlier. CDC says about 5 times, so we're sort of in that rule. So we have updated isolation and quarantine guidance. It lessens it. It does lessen it, lessens the time frame. And also home kits. Home kits are good. It's just, again, they're going to sort of be off the radar. But we're working, I think, like I said before, it seems to be we're working more towards into the, the home kit and, sort of home, much less that sort of strict quarantine guidance and strict isolate, the things that we used to do as a health department, the contact tracing, the real detail, that's sort of going by the wayside, and working more towards teaching people how to do it themselves. Contact tracing is what it is. So if a public official calls you and says you're out for 10 days, or, you get a piece of paper email and says you're out for 10 days, or that's 5 now, but, was 10. If you have the information, it's about taking personal responsibility. And so I think we're working more towards that. Not that we were able to sort of board up your doors when you were positive anyway, to begin with. So this is a long presentation. Just, again, a recap. Case counts are very high. If you're unvaccinated, it's going to be very difficult this winter not to get it. It's just really, it's everywhere. Again, if you're vaccinated, vast majority, it's going to be mild. It's going to go away. It's going to hit. It's hitting really hard right now. Get yourself a booster if you haven't. We're going to work our tails off to get more clinics going. And so we, again, doing all the avenues and keeping up with the stuff and ordering things when we can and, following the guidance and so forth. So I will do another presentation next week, and everybody have a good new year. Thanks.